Hi, I wanted to give you some more healthcare tidbits. This is what we do all day long when we work in the hospitals, nursing homes, assisted livings. And as nurses and healthcare employees, we've been battling with so many other issues and pathogens throughout the years. So I feel like having that knowledge, I always want to pass it on to other people because I know there's a big scare out there. A lot of us in healthcare are taking it one step at a time, and we are actually just trying to bring a little calmness and knowledge to the public. So I know I spoke about hand washing like 10,000 times, and whenever you see me, I'm going to keep talking about hand washing because that is the number one, like I said, the first step, number one way to break the first chain of the cycle of transmission through pathogens. And so we'll talk about more about that yet later. I basically want to talk about something that I saw twice yesterday. I spoke out against it, and just if you are doing it, I want to let you know that you have to stop. Okay, so I went to Walmart to save a lot because I was looking for like toilet paper and hand sanitizer, etc. And I saw employees with gloves in their hands. Actually, the one at Dollar Tree was horrendous. Like basically the index finger part was already removed. His glove was supposed to be like a cream colored, and it was nowhere near that color. So the policy for gloves are, if you're going to wear gloves, you have to take it off between each contaminant. So if you're touching, like for example, the employee yesterday, I was looking for like luncheon meat, and he was basically touching every meat that was there, and then touching the packages with the same blue glove that he had on, and that was at Walmart. And I was like, stop. I said, you basically cross-contaminated every single one of these. And I know he didn't understand, and I looked at his glove, and it was basically like sweaty on the inside. It was hot. I can see the print of his hand, the outline of his prints on the outside. So I said that you basically have to take off your glove with every touching of any contaminant, and on top of that, you can't have it on for more than an hour, or when your hands start getting sweaty inside and warm and moist, that is a perfect medium for bacteria, viruses to continue to grow. You've just made yourself a petri dish of pathogens, and then passing it along to other people, because as that same person now touches a cash register or touches your product, if you ask a question, they just became the perfect carrier for any pathogens that's in their hands, that's on their hands or on their glove hands. He did apologize and did say that he was going to take it off, and did say that he was using like hand sanitizer in between. Please, no. The alcohol erodes your gloves anyway. So please don't do that. When you use gloves, you must change them between contaminants. You must wash your hands each and every time you take your gloves off with soap and water for 20 seconds. Soap and water, soap and water, soap and water. And take off the soiled gloves, throw them away. And with each new glove, you need to make sure that as you touch contaminants, don't keep the gloves on. Actually, in healthcare, we despise seeing other people with gloves because we know that, oh my gosh, they're going to keep those gloves on for hours. Please do not keep your gloves on long. Please do not cross-contaminate with gloves. And if you have gloves after you touch a barrier or a surface that is possibly contaminated, take them off, wash your hands, and re-glove. My real suggestion is don't use gloves. We have a thing in healthcare that says when you use, and I'm not talking about like healthcare, like in healthcare we know to use gloves. I'm saying out there in the public, if you use gloves, we know that you will not know when to take them off. And by not knowing when to take them off, your glove become a perfect medium for pathogens to grow. So I'm not going to say don't use gloves if you don't want to. I'm going to say if you don't know how to properly use gloves, take them off and wash your hands. Please do not use gloves because you are now a carrier. Have a great day. This was my 2-bit about gloves. I've seen it happen in 3 stores, Dollar Tree, Save-A-Lot, and Walmart yesterday. Please tell your employees, tell your people, do not use gloves if they don't know how to properly take them off, because that actually makes it worse. Have a great day, and I'll give you some more healthcare tidbits. And here's my credibility. I've been a nurse for years, and we've been knowing how to do this. Healthcare needs to take the reign when it comes to this pathogen, because we've been dealing with SARS and many other pathogens that are similar. And it's not that I'm not afraid. I just know that precautions really work. And if I can share that with you, that would be great. Precautions really work. Have a great day. Bye.